Hello everyone, thanks for joining us for this video today. Today's video is for those people who are currently expecting a baby but haven't delivered yet. So I just wanted to give you a few tips on trying to pick your pediatrician. I'll do additional videos for parents expecting a baby, but this is not going to include all of those details, just the part about picking a pediatrician. So first of all, I would encourage you to get one that's relatively close to where you live. This can be tricky depending on where you live. I have had a lot of parents to ask me, maybe the scenario was that they moved away several hours away, but they wanted to travel back to see me just for well visits and then do the sick visits closer to their home. And that actually, as much as I would love to see them and we'll miss them when they move, probably isn't a good idea. Your primary care physician, your pediatrician, needs to provide both your sick care and your well care. We really encourage this concept of the medical home because I need to know how many antibiotics the baby's been on for ear infections. Is it time for me to refer them to ENT for consideration of tubes? I need to know if they've had 6 episodes of strep in a year. Again, they may need to go to ENT for consideration of the tonsillectomy. And so if your care is piecemeal, one place for sick and one place for well, it really doesn't work as well and is a not ideal situation at all. So I would encourage you to go relatively close to your home, whatever is close enough to be convenient for you for routine well visits. Remember, when your baby's first born, there will be a lot of visits to begin with. We generally do a first office visit well check and then several weight checks potentially until the baby's weight has begun to increase and we've documented that increase. And then there's a 2-week well and a 1-month well, a 2-month well, a 4, a 6, a 9, a 12. So there are going to be a lot of visits during that first year of life. You wouldn't want to be several hours away from your pediatric office, particularly if there were an emergency where you need to come in on an urgent basis. So location is important. Another thing that's important is that you verify that your pediatrician is board certified. So I have a little trick for you. If they have their name, Dr. So-and-so, and it says after their MD, FAAP, that means that they're a fellow of the American Academy of Pediatrics, which means that they are board certified. You can also Google the American Board of Pediatrics, ABP, and check on the certification status of your pediatrician that you're considering joining. After you find one that's close enough, that is board certified, then I would say let's check out their website and make sure that their philosophy agrees with yours. It is extremely important that your pediatric practice insists on its patients getting vaccines. If it does not, your child in the waiting room could be exposed to other babies coughing pertussis germs on them. So it's really for your own child's protection if you choose to join a practice that has a vaccine policy. So I would encourage that. Another thing to look at is whether or not your practice rounds on the newborns in the hospital. Now, this varies from location. Many hospitals have excellent neonatologists or nurse practitioners or pediatric hospitalists that round on the newborns and do fantastic care. So this is really a matter of if you had 2 practices that were equally good and you were trying to pick, you may prefer the one that does hospital rounds so you would know them from the very beginning in the hospital. We can provide perfectly excellent care from babies that are born at hospitals where that group doesn't round. The transfer of care is easier than it's ever been now with computerized healthcare records. So you know, it's up to you, but that is one thing you might want to look at. You also want to know what after-hour services that pediatric office offers. So do they have evening clinics? Are they open on the weekend, on Saturdays, Sundays, or both? Another extremely important question is, if your child ever has an emergency, where will they send you to the emergency department? So it is absolutely ideal to get medical care for children in a pediatric emergency department. The quality of care from a tiny community hospital, the ability they have to provide emergency care for infants and children is drastically different from a pediatric emergency department. That is very much worth your drive. So you would just want to know if your child ever had to be admitted for IV fluids, a severe asthma exacerbation, appendicitis, or what have you, whatever it may be, which hospital will that be, and do they have all the backup of a pediatric intensive care unit, a neonatal intensive care unit, pediatric subspecialists such as pediatric surgeons. So it's really important that you know where your pediatric practice sends patients to be admitted. I have been in so many different scenarios in my life, and I can tell you that some of those tiny community hospitals, while generally well-meaning, really put pressure on the primary care providers, such as pediatrics, to keep their inpatients close to home, even though the quality of care is not as good as that child could have received in a larger university-based hospital system, or just a larger hospital in general with more services to offer. So that matters a lot. Now, the size of the practice matters a lot, but it depends a lot on what you're looking for. I'm currently with a very, very large practice, and that has so many nice parts to it, things that I didn't have in smaller practices previously. When you're in a larger practice, you can often afford to offer lactation services, and they're actually currently at no cost to our patients. We can afford to be open 7 days a week at one of the locations. We can have multiple locations, which is convenient. There are just so many different providers. You could find one that you really meshed with because there's so many to choose from. Now, the downside is it may be more difficult to get in with your chosen provider because there are so many others, and because there are just so many more patients because the practice is bigger. So a smaller practice could offer more intimacy. I've been in a practice before that had only 4 providers, and I really feel like we knew all the patients and all the patients knew all 4 of us, and that's not the case in a much larger system or practice. But then with a smaller group, we couldn't afford to offer as many really nice services that a larger group can offer, like lactation consultation. So there are plus and minuses with the size of the group, and that's more about what your personal preferences are. So I think that's an important thing to consider as well. So look on their website, see if you agree with their philosophy, make sure they're board certified, make sure that they insist on a vaccine policy for the patients, and then just call them up. You can call the office and see if they have a good nurse triage system. You can find out what their plan is for if you have overnight calls after the baby's born, how are they going to deal with that? And a lot of times that'll be spelled out on their website. Make sure their website's good. Make sure it looks like it's relatively modern and they've given it a little bit of attention, because in these days that really matters. Now, in the days of COVID, it also matters as far as how they're handling it. Are they doing outdoor drive-through clinics for children with fevers and respiratory symptoms? Or some practices are doing all well visits in the morning, big cleaning, and then all sick visits in the afternoon. There are multiple ways to handle it. Just make sure that they do have a plan and a policy for handling it, and just check out what other additional services they offer on their website. Or they may have breastfeeding classes, they may have baby care classes, which is a really nice idea if they do offer that. Also, as with so many things these days, word of mouth matters. If you have friends who already have children, it's a very smart thing just to see, are they pleased with their pediatrician? Are they pleased with the way the office runs, the website, how they pre-register for well visits, things like that. So just ask around and see which groups your friends are comfortable with, and that can often be a really big help in making that decision. Now, when you're in a larger area and there are multiple pediatric offices competing, for your business, then they also will often offer this class that teaches parents of about to be born babies exactly how they manage everything. So we call them pre-baby classes or meet and greet classes. And before COVID, we had those in person, and it was very warm and cordial, and we shook everyone's hands and answered all of their questions. But now that we have COVID, we're doing ours virtually, and probably other places are as well. So just remember that a lot of large groups, and especially in large cities, will offer you some sort of meet and greet to the providers in the practice. You also want to have a reasonable ratio of MDs to PAs and nurse practitioners. PAs and nurse practitioners are fabulous. Make sure they are pediatric trained, so the nurse practitioners would often be PNP or pediatric nurse practitioners. But I just want to make sure they have a good ratio of seasoned pediatricians to offer wise counsel and advice that they could consult with if needed. So I hope these tips were helpful for you in helping you to select a pediatrician before your baby is born. And you don't have to do anything with the office of the pediatrician usually, but it is helpful for you to know who you're going to pick before you go to the hospital, because your baby's newborn screen that gets sent to the state lab, the results have to go out to some doctor somewhere. So it's helpful if you can tell the hospital where you'll be following up. And also, after the newborn is discharged, you'll have to follow up at the office in 1 to 2 days. So 24 to 48 hours after discharge. That's the current recommendation of the American Academy of Pediatrics, depending on how your baby's doing on the day of discharge. And so you have to know where you're headed, and most hospitals will make you make that appointment before you leave, which is a really good reason to pick a practice that is available 7 days a week. Okay, hope that helped. Thanks.